It's been 1 year since I have finished radiation therapy, and so I thought I would just give a little update on how I'm doing and then also give just an overview on the radiation, kind of put it all in one video of the whole process, what it is, how it works, what the side effects are, and all that kind of stuff. So, hi, I'm Jenny. Welcome if you are new here, and welcome back to everybody else. I started my cancer journey back in February of 2023. I was diagnosed with a cancerous tumor in my rectum, and so I got hooked up with an oncologist and started my chemotherapy, and then after that ended up having radiation. Ultimately had surgery in December, in which the surgeon was able to remove the whole tumor, and I am cancer free and, well, in remission. So yay, happy about that. So yeah, what is radiation and how does that all work? I have some notes here so I can get it all real correct and make sure hopefully I don't forget anything. So there you go. What is radiation? It is a type of cancer treatment that uses high energy beams like X-rays to kill the cancer cells. So you don't see them at all. It's just, again, an invisible laser that goes to your body. So it's an external beam that aims at a precise point. It destroys the genetic material that controls how cells grow and divide. Unfortunately, it also gets some of the good cells because they can only do so much. They aim it where they can to get as many of the bad cancer cells as they can, and your healthy cells usually are able to heal themselves with any radiation that has hit them. It can be used before surgery to shrink the tumor, and it can also be used after surgery if there are any cancer cells left in there to help stop the growth of those. So in my case, the surgeon took out my rectum and took out the tumor. That's where it was. It was also butted up against my vaginal wall, so they had to take out a portion of that. So it was so close to the sphincter muscle that they could not save that area. They weren't able to reconnect my colon down to be normal. So they did sew everything shut. So I do have the Barbie butt. And they did a muscle flap procedure where they took a rectus abdominis muscle and they cut it from the top, and they took that and they flipped it over, and we're able to take that down in the area to close up the back of the vaginal wall and close up the anus area. So because they weren't sure if they would have gotten all the cancerous cells, the surgeon did put a BB in the area of where they had removed stuff. They also did a hysterectomy on me too, but that was kind of preventative, just to make sure in case any cancer cells had spread there, that they would just get that all removed and hopefully have me good to go, which so far so good. The radiation, unfortunately for me, did not shrink the tumor at all. So I was so grateful that the surgeon was still able to do the surgery even without that having had happened. Most of the time it does shrink the tumor, it does what it's supposed to do, and that's why they use this therapy. Part of this therapy also is that you take some type of a chemo pill. So for me, I was taking Xeloda or capecitabine, same thing, one's generic name. So I was taking those also throughout. So because they did get all the cancerous cells from me, again, a couple of days after whatever, the tissue was all sent to the lab. They did a test on it, and there was no cancer cells on the margins of what they had taken out. So I did not need radiation after that. So again, that's why they did have the BB in there, just in case I would need more radiation. Then they would have known exactly where to aim the beam for more radiation. How the whole process works is when they're getting you ready to have radiation, they make a mark on your body. Sometimes they do a little bit of a tattoo. They give a tiny permanent tattoo, which is kind of like just a little pencil mark, just like the period of a sentence type of thing. They would do that. For me, they didn't have to do that. They did this process where I went in. They kind of give you a session where you go in to the office. It's usually the radiation office. They have a machine that they can get you set up on, and they do the the marking process, the the marking of the machine type process, so they know exactly how to line you up. The office that I went to, they had a foam cushion thing that it forms around your feet. So I laid on the table, they had me kind of centered on the table where they wanted me to go. They had this thing under my feet where I was, and when I was good to go, it's kind of like one of those mattresses that comes like vacuum sealed. And then they like, you take out the vacuum, you cut open the packaging, whatever, and then the whole thing will blow up to its original size. Well, it was something like that, where wherever I was laying, it was good. They released the whatever, and it kind of went whoop, and it went around my 2 feet and formed a little foam form. So again, every time that I would come in for radiation, I would be, I'd lay on the table and I'd get my feet in that little foam form. They had my name on there, they put it off to the side. So when it was my time to come, they'd put that form on the table. I would lay on there, my feet would be exactly where they would need to be, my body would be pretty much in the exact same spot every time. Then they would do the laser beam lining up from the machine. They, put a little light. It's not a laser beam. It's an actual a light that shines down on your body, and they can see where you are, and they kind of line you up, and they're looking at the computer. And again, they try to make sure they get you lined up in the exact same position every time. So that, yeah, they have the guide to do that, so they know where they're going to put you, and then they also figure out what dosage of radiation that they're going to give you. So the actual treatment, you wear a gown, depending again where radiation is. I'm going to go over for mine, being in the rectum. I had to take off my pants and my underwear. So I could keep wearing my shirt, but I took off those and I wore 2 gowns. So one gown went obviously with the opening to the back, and then one gown was kind of like a house coat. And then they would, take me back to the room. I had to drink like 24 ounces-ish of water for everyone, because they wanted my bladder lifted up out of the way. So that would help kind of save the bladder and your urinating process. So yeah, you have to drink all that like on your way, within about 15 minutes or so of your appointment. They want you to have that in your system. So you can't go to the bathroom when you get there. Get your gowns on so you get changed. They take you back into the room, and it's a 15-minute procedure. It's pretty much all the appointments were like 15 minutes apart. They get you in and out. So I mean, 15 minutes is the amount of time that they get you back in there, get you laid on the table. So you take your house coat little gown off, and then with the other gown you kind of get that gown out. So you're pretty much kind of get the bareback type thing, whatever on the table. They ended up putting like a pillowcase across my private area. Because that's where they were radiating, but so again, you're not just hanging out there naked. They put a little covering on you, a little towel, or I think it's a couple times I had a pillowcase over me. And get me, all lined up, and then they step out of the room and hit whatever little button, and then the machine starts going around your body. So it's all open. It's not like the MRI or anything. It was all open, and then there's like this machine that's there. And it goes a good, 12, 14 inches away from your body. So it has like these 3 separate arms. So there is an open area type thing, but then as it starts going around, you'll have this machine part, kind of over your body, and then this other part over your body, and then there's like a third part, and it kind of goes around, and then it stops for a minute, and then it comes back. And then usually my table would just adjust a couple millimeters. And so again, that's so that they are completely exact of where they're giving you that radiation every time. So when I had my doctor's appointment, after one of these visits, I went and I saw the doctor, and he showed me, he brought up the CT scan of the one appointment that I had, one of the treatments, and he brought up a CT scan from like one of the original appointment where they kind of like marked me, and he overlapped them, and they were completely exact. You wouldn't be able to tell that it was 2 different pictures. So they want to be exactly exact. The appointments are Monday through Friday. They usually try to get you in that. They want to get you those 5 days in a row, and then you get the weekends off. And you get about 28-ish treatments. So again, depending on your type of cancer or whatever, you may go less, you may go more, but it seems like for at least colorectal cancer, this is kind of the norm of about 28 treatments. You don't feel anything. Like I said, again, you lay there, the machine goes around, it does its thing, it kind of goes around, it does its one thing where I said it kind of marks you, and then it moves the table a little bit, and then it goes around, and it waits, and then it comes back, and then it's pretty much done. ladies come and get you. Like I said, it's 15 minutes tops by the time I'd be out there. That make sure I go to the bathroom and be able to get dressed. You're in and out. So again, sometimes it may take a little bit longer, depending on if people need a little extra time, either getting on or off the table, or depending on how they have to set you up and what they're doing. It may take extra, but that's, again, pretty much the norm. And in my area, they also nicely had music playing. So they asked me what music I would like. So I told them I wanted Bon Jovi. So again, after they get the room all set up and they go back into their little room, they're kind of outside there, they have speakers and they have cameras in there so they can watch you and see you. They have microphones in there so they can talk to you, and or if you are, you know, having an issue or whatever, you can talk and they can hear you. But yeah, I had music playing, so again, that helps kind of calm you down and relax you, and it's all good. So again, nice and fast. Some of the side effects that they say can happen. I will read off all the side effects and then I'll go through and tell you which ones that I had and how it affected me. So, skin irritation at the site where the beams are aimed at and or blisters, delayed wound healing, nausea, rectal irritation, diarrhea, bladder irritation, fatigue and tiredness, trouble urinating, hand-foot disease, or I don't know, hand-foot, hair loss, and pain. So these symptoms usually do go away after a little bit of time, and the effects of the radiation does last for several weeks, up to a year. So again, I didn't know that up to the year point until later, but I was told that it did last for a good like 4 to 6 weeks. And after that is, if you're going to have surgery, then they can do that. So again, for me, it was like they waited at least that 6 weeks. This is because they also want the tissue to heal up enough so that when they are doing surgery, if they need to sew in that area or whatever, they need that tissue to be healthy enough that it could hold stitches, so it wouldn't like break open and stuff like that. So I did have my 28 days, so that was 5.5 weeks. With the pills I was taking, the chemo pills, I was also given some anti-nausea pills. And the first day I did take the chemo pills, I had to take those twice a day. And after my first dosage, I did feel a little bit of nausea. So I'm like, I'm just going to take an anti-nausea pill to, you know, just as a as a buffer, as a side, as a preventative. Then I'm like, I'm going to take that. And I did continue with that then, pretty much with every dosage. I ended up taking one anti-nausea pill just so that I'd be sure that I would be good to go. Yeah, because the other chemotherapy was all IV chemotherapy for me. This was the pill chemo. So skin irritation, I did get that. I was told kind of about that 4th week, that is when it starts. And that was pretty much the way it went. After that 3rd week, within that 4th week, my butt started getting all red and itchy. So I did take some Claritin, because I was also told that was another thing you could do, that if you're itching, you know, take a Claritin and see if that'll help you. Rosie's gonna talk and say hi. Hi, Rosie. Yes, you could be part of the video. So I took a Claritin if, for some days when I was feeling the itch, you know, badly or whatever, I did take that. It did help. They also gave me some cream. I was going to bring it down with me. I will put a picture in. They gave me some, I think it was the Remedy. Oh, of course, I just know. Some, you know, whatever, some Remedy cream. They gave me the cream there from the office. They also gave me a bottle of, a tube of Aquaphor. So I could use that one too. I didn't end up using that one. I did use the other one. The other one did also have like a anti-pain words, chemo brain. I swear, I had more of it like almost now than I did when I was going through all that. Component. There's an anti-pain component in this lotion. So I was putting the cream on for myself for like a week, and by that, during the 4th to the 5th week, it was so bad, I actually had to have my husband help me. So I felt bad. I had to humble myself. I had to, just be there. He didn't care. He was like, whatever it takes, whatever you need me to do, you just let me know. I'm here for you. So thank God. He's so wonderful. But in order to get enough cream on there and get it to the right place it needed to go, it was nice to have him be able to help, because I was trying to put it on myself, and then like after I'd go to the bathroom, I'd wipe it all down and I put the cream on there, and by the time I'm standing up I would see some cream like drop at the toilet or something. I'm like, well, then it's not sticking on me and it's not going to be of any help. And so even when he was helping me, he saw too that I did have some areas that were kind of red and raw. It was just there was a little bit of blood showing, and so he had to dab away at that, try to dry it up so that the lotion would actually stick on me, and so that would help. I also was given some bath, like Epsom salt type little packets that I was supposed to do these little sitz baths like twice a day. That was also supposed to help dry up the area and help with pain. I did put some just in a regular bathtub. I poured a couple packets in. I took a bath that way. I would do that like once a day or every other day, and that kind of helped. I tried to do a little sitz bath thing. I had a little I don't know, a little container. It's almost like one of those like urinating things. If you put it on the toilet, if you have to pee into it, like type thing. One of those type of things. I tried doing a bath type thing on there and tried sitting in there. I was like, my butt was like just small enough to kind of fit in there, but that was just not really happening. So the regular bathtub, I would pour the stuff in there, and again, nice that the doctor gave me that stuff, and it did kind of help. After radiation was all done, so after that 28th day, that's when the blisters formed. And whether it was later that day or the next morning, but at that 29th day, it was interesting that then I had blisters, and I had like a couple big ones. I had them on both sides of my butt crack, and I had like a big one or two, and then I had a couple little ones and little ones on the other side. So same, we just put the cream on twice a day, and just FYI, make sure, like, if you're a woman, wear a pad, wear an extra long pad so it's covering that area. Or sometimes they have like gauze and stuff either in the store that you can get, or you can order online, or the doctor may have it for you. But to wear something over that to kind of protect, because it does get onto your clothes, and I do have like a pair of pants or two that get stained and didn't come out in the laundry. So if it's an oily enough type cream or whatever. Otherwise, again, I would just wear my long pad, and that would help. So for that area, and it still helped. The cream was good. Sometimes it was worse at bedtime. I'd be laying in bed and I would just be itching, and I would just be like, ah! So sometimes I'd go to the bathroom in the middle of the night. I'd try myself. I'd put some more cream on there so I could try to make it through the night and sleep. It took about 11 days for the blisters to be gone. So granted, it started that the day after like I said, when I was done with radiation, it started that day after. And it took 9 days for the blisters to completely go away. I also ended up having skin that got dark in the vaginal area. So in the area where your thigh kind of meets your body, that leg area, the skin there did turn really dark, and that also started kind of flaking off after radiation was done. So the doctor told me, I think it was kind of where the Aquaphor cream type stuff more came in, to put that on there. Again, if I was itching, I could have used the other cream. I did not. I did use, I think, the Aquaphor cream a couple times just to help keep the skin moist, because I didn't want it, again, getting too dry and tearing off and bleeding. I didn't have that problem. It also was a little bit dark over the vaginal area, so that whole skin. And that too, by the 15th day, I think that started to peel, and that, got better. So as of this time, it took a couple months, and that area all healed up. The darkness went away, my skin turned back to normal color, and that was all good. So next, delayed wound healing. I didn't notice any of that. I didn't get any scrapes or bumps or whatever, or bruises that I noticed of anything. Nausea. I didn't really have nausea. I didn't do any throwing up. I didn't really feel nauseous, but then again, I was also taking the anti-nausea pill. And again, for preventative. I didn't really feel it, but I just was like, I don't want to feel it. so I just did. Rectal irritation / diarrhea. Again, I already had my ileostomy. I had the bag. I was grateful for that. It was a matter of, I did have a lot of diarrhea throughout the whole process. And so a lot of my output, it was all watery. It was all like diarrhea. But because it was coming out of my stoma, I didn't feel it. I didn't have any pain. It was a matter of, I was emptying my bag every time I went to the bathroom. Sometimes it would be really full. Sometimes it would be, a quarter or half full. It was just a matter of, if I'm going to the bathroom to go, urinate anyways, and I'll just might as well empty my bag while I'm in here, because I don't want to go sit back at the computer and then within a half an hour it fills up and I have to go to the bathroom again or something. I'm like, I want to give myself like another 2 hours. So I probably was every 2 to 4 hours I was going to the bathroom and emptying, and but I did not have pain. I know people that don't have a bag. If they've just got the regular rectum area they go a lot, and with a lot of wiping they'll get sore. So try to use it. I know they even told me to use baby wipes if I needed to, but I didn't need any of that, because again, I had my ostomy bag, and so that was okay. But I did have the diarrhea. Bladder irritation, I did not. I know with every visit they were all like, "How are you urinating? Is urinating going okay? Is it burning? Is it hurting? Is that And no, I was not. Again, to learn later, now as time has passed and having read things, that having bladder problems is also a thing that happens. So I did not have any of that. Fatigue and tiredness, I didn't feel any fatigue per se. It didn't feel to me that I was that tired. I would go through my day, I was running errands, because I had the radiation every day. I would do that, and then I would go run an errand. I'd go to the grocery store. I would go, drop off something for Goodwill. I would go to the post office and mail something or whatever. So I was running errands a lot of the days. I was good until about 3 p.m. And then it kind of hit me. Then I was tired. Then I'd go lay on the couch and I'd take an hour nap. And then I was good again till bedtime. Towards the end of the radiation, the last week or so, I think by 1 o'clock I was getting tired. I'd be sitting at the computer and I'd notice I'd fall asleep at the computer and all that. But I was able to drive myself to every appointment, which is good, because again, I also know of people that have had radiation and they end up needing somebody to drive them by those last appointments. Battery's blinking. I need to change my battery. I'll be right back. Okay, so what else? The tiredness also could have come from the chemotherapy pills. Not sure. Also at weekends, weekends were better. That's why I'm thinking of weekends. I seem to have a little bit more energy, because on the Saturday and Sunday I also didn't have to take the chemo pills. So that may have helped energy-wise. I couldn't really stand in the kitchen for an hour and that to try to cook, but that also may have been because of the tumor in my rectum, because even before all that, and throughout even all this, I was taking Advil every 6 hours for pain relief. And I needed to take it every 6 hours. I couldn't just hold off and say, and wait till I was in pain again and say, oh, let me take some more now. I tried that, and that didn't happen, because that time I was in pain and I took my dose of Advil, it barely worked before I was ready for another dose. And then when I took that second dose, and then I was like, okay, I'm back to my level of no pain relief. So I ended up just staying on that schedule of every 6 hours. So I would set my alarms, and throughout the night, when I go to bed, I would set my alarm. Within that 6 hours, I would get up and I would take my Advil and go back to bed, so that I could make sure that I was not in pain. Because with all that, trying to do dishes, I would get really tired and I'd be in pain, and I would just kind of hurry up and push through them and go sit down. I was trying to make meals on the weekends or something. I would, try to make a soup or whatever. If I would try to stand for more than an hour after cutting up vegetables and all, I was done. I had to go sit. So again, I think that was more tumor related than radiation. So as far as tiredness, but on the trouble urinating, no, I didn't have trouble urinating. I didn't have pain per se with that. In reality, I did end up getting pain that, when I was urinating or towards the end of it, I would feel pain, for me being a woman, more towards the vaginal area. And it was again almost because that was what was all raw. Because with my whole, in between the butt cheeks, the whole butt crack area was raw. And it was raw down to the base of the vaginal area. So when I would have urine leak back there, it hurt more on the skin of the vaginal area as opposed to just hurting urinating. So that was my urinating pain. But otherwise, yeah, I was good. Hand, foot. I was given a handout in the beginning with a radiation of, again, side effects. That would be, and the hand, foot was one of those. Now, again, I'd heard of hand, foot when my kids were little, and they go to school, and you have the hand, foot, which is like a little rash that happens on your hands and feet. And then it can get to your mouth if they're doing that. But again, obviously being an adult, I did get a little bit of that, very, very mild. On the bottom of like one of my feet, I did have a couple of red dots, and it was itching, and I did get one little blister. It was fine. And then on one of my hands, I ended up having like 2 callus type areas. So again, it was almost like, it didn't blister or anything, but it was more of like a callus. It had itched a little bit, but then it got to be rough. That went away right away after everything was done. Yeah, it went away within the week of being done. Hair loss, yes. My hair thinned. I didn't have any hair loss at all throughout this whole journey. The type of chemotherapy that I got was also that my hair just thinned. I didn't lose it all. It thinned enough that I noticed that I've got pretty thick hair. So when taking a shower and washing it, I mean, I did notice that it was thinner. And also anytime I would run my fingers through, I would have a couple hairs on there throughout the whole day. Now I can do that, and yet there's nothing there. So the hair did thin. And I also had hair loss on the vaginal area, which again, didn't notice until one of the times I was changing my bag and happened to glance down there. It was like, oh, hey, there's like no hair in this little area. So that was really interesting to me. I don't know why. I didn't think of hair loss. I was thinking, I think I had hair on the head, not really hair on the body. So there's that. Pain. Like I said, yes and no. I was on the Advil anyways every 6 hours, but even with being on that Advil, I did have some of the pain from the redness from the radiation that was in my butt cheeks. It was mostly the itching, irritation though, and stuff though, that was a little bit painful, but more itchy. Besides that, other things that I ended up having happen was hot flashes. Then again, I don't know if that's even the whole chemotherapy thing, because I think I had hot flashes throughout even with getting chemotherapy, but even with getting the radiation, I would have hot flashes all day long. So not enough to the point of like I wasn't really hot, sweating hot. It would just be like, oh, I'm hot. So I was kind of like, oh, I'm hot, or I'd lift up my shirt and whatever. Then the air would kick in or something, or other. I'm like, okay, now I'm cold. Put my shirt back down. I'm pulling up my pants legs, and so it was enough to be warm, but other than that, I was always cold. My husband's like in shorts and a tank top or whatever, and so I'm in pants and my socks and my shoes, and I'm cold. And when I get a hot flash. So my temperature was, off. Neuropathy. Because of the chemotherapy pills, that is one of the side effects of that. Also is numbness. So with the chemotherapy, the IV chemotherapy drip stuff that I was getting, that medicine, I got tingles in the fingers, and I had a cold sensation where you couldn't touch anything cold. It felt like pins and needles. It felt like you were getting kind of like stabbed by knives. With the pills, it was numbness. I had the numbness. The numbness neuropathy. So that happened in both hands and both feet, and up the legs a little bit. So now at this point, again, being a year out, my hands are okay. My hands have come back 100%. In fact, that I think was at about the 9-month mark that that my hands were 100%. My right foot is pretty good. It's even gotten better within the last month or so. I've noticed a difference. That it's just like my toe area, the toe and the ball of the foot, that I kind of still have some numbness. My left foot is still kind of the whole foot, but it's like gone on the legs at this point. My legs are fine. So again, it's taken a while, but again, thank goodness I'm healing. I'm getting better. I know people that have had still their neuropathy for 2-3 years that they're still dealing with that. So mine is still getting better, which is good. And I'm so happy my hands are back. It is so nice to be able to grab things and not drop them, to be able to type, and not keep making mistakes and all that. What else? I'm cold. My cold, yes, I'm cold more than usual. At one point there was even, a bath was actually too hot for me. Bath water, the bath itself, when I just do hot water in the bathtub and run it, it's always like it cools off for me within 15 minutes because the tub itself is cold. And all that, well, there's one time Wayne drew a bath for me. Normally I boil a pot of water on the stove to then put in the bathtub to make it warm enough for me and to have it last. Well, the hot water from the faucet actually was too warm. We actually had to put cold water in there. And Wayne was just like, his jaw dropped pretty much. He was like, are you sure? Really? Like, this has never ever happened before. I'm like, we would put cold water in there and keep pushing around. And it was still a little warm. That never happened. It only happened that once. But appetite was pretty good throughout the whole thing. Sometimes food tasted funny to me. Especially in the beginning. It would be like, we had pizza one time and we had, I don't know, macaroni and cheese. We had something and I was like, this tastes kind of funny. Wayne's like, tastes fine to me. I'm like, okay. So that all went away right away. My weight remained stable throughout it. That was also good too. They were also happy with that because every week, every 2 weeks, I think, I visited with the doctor. No, every week, because I had the sessions, it's right, Monday through Friday, and then on Tuesdays I would see the radiologist. And so then they would weigh me and take my blood pressure and all that, and my weight remained stable. So they were very happy about that. They did have a dietitian there too that they, she talked with me, and I was like, I'm good, I'm stable, I'm eating. So that was all good. Nice to have had that option, but I was good. So that was good. That made us happy. That have my weight stay stable. And things I learned later. So after surgery, a month after surgery, I ended up having an intestinal blockage and ended up in the ER. And ended up having an NG tube down my nose to my, oh my God, that is the worst. I feel for any of you that ever have to have an NG tube in. I just, one of the YouTubers that I watched just had to go through that. He had another surgery and he had the NG tube in and he was able to talk fairly well, normal. Like, how? I couldn't talk. Every time I tried to talk, I'd start gagging. So I ended up whispering, which thank God everybody was fine for. All the nurses were good. The doctors were good. They understood. I couldn't, and they took the NG tube out and then I could talk. And then the nurses would come and check on me and I would talk and they're like, you're talking. Yeah, this is what your voice sounds like. And I'm like, I know, isn't it great? But, so in any case, during all that, I was told that usually the NG tube, they said, helps it out with time. The blockage will pass, and they did see like a narrowing in the intestines, but it enlarged itself while I was in the hospital for that week and got itself better. But she did say that adhesions can form on the intestines. And she either had seen a couple when she was in there doing, the surgery, but whatever. There also could be, more that have formed or whatever. They won't know unless they go back in to do a second surgery, which I opted out for. It was like, well, we gave it time. The blockage did pass and we figured, okay, good enough. If by chance this happens, again, where it's so bad, then I may need surgery. But right now, everything has been going well. I learned my body, I learned how it goes. I have had a couple more stomach aches that are kind of a blockage type stomach ache, but I kind of just make myself wait through the pain. Just gotta sit there and get through it. It usually lasts about 4 hours and then I'm good to go again. Figure out what it was, either that I ate or usually just ate too much. I can pretty much eat anything, but it's a matter of quantity. Like I can have two pieces of cheese pizza, but if I have 3, I might get a stomach ache. So things like that. You kind of learn your body as you go. And then when I had my last radiation appointment, the last day of radiation, I was told that he would see me again in January. He knew my surgery was in December, and so I'll see you again in January. And I'm like, why are you seeing me in January? I don't get it, because I'm having surgery and whatever. He's, well, I just wanted to, check up on you, make sure you're doing okay. He goes, and then I'll fire you. Ha ha ha. I was like, okay, whatever, I don't get it. Well, okay, again, going through this process, realizing how it all goes, knowing now that if they don't get all the cancer during surgery, because I don't know, in my head that wasn't an option. If they hadn't gotten it all and I needed more radiation, that's why you have that appointment after surgery, again, when you're pretty, getting healed up. I had the appointment then with him, and then he's like, okay, they got all the cancer for that, so now you don't need to see me anymore. But also at that appointment, they gave me a dilator and asked me, again about the urinating. That was fine. Mentioned that I could get adhesions on the bladder, which is why they keep checking, again, whether you're urinating okay. And also why they wanted you to make sure that bladder was out of the way when they were doing the radiation. But also being a woman, they started out with this vaginal dilator, which, was like the thickness of my finger, super tiny. But to use that, I was supposed to use that 3 times a week to make sure that I don't get any adhesions in the vaginal area. And I think that's obviously dilator in that area is all that's going to help. Doing the stomach massage and stuff can also help with adhesions not form on the stomach. So I was doing, because of my midline scar, I was doing massaging on the abdomen for a couple months with that till I got to the point where it wasn't as sensitive as it had been. I still probably shouldn't be doing those a little bit here and there. But again, either when I've had either a stomach ache or once in a while when I'm just sitting at the computer, I do. I still have a little bit of pain. I have been told it does take a year for everything to heal. So again, it's going to take a year for the midline scar to heal. I do have like the mesh in there too that they use to help sew me shut. I was told that mesh would dissolve within a year. As far as the butt surgery, I think it's called proctocolectomy surgery, that also takes a year to heal. That I can tell too. I've had kind of a roller coaster where I've been pretty well good and I feel okay, and then it's like then I'll feel pain. I have some chafing going on. I have whatever. It's maybe a couple dots of blood if I went back there or something. And then I'm good again. So that's still healing. So as far as the vaginal area, to use a dilator 3 times a week, or unless you're having sexual intercourse a couple times a week, to again keep that area all flexible. The other thing that could be an option, putting it out there, if any of you are going through radiation, that it may be possible. I've heard that you can also use a dilator. You could put a dilator in during radiation. So again, that would also help keep that area safe, and I guess have less chance of getting adhesions and that. So that is an option. Just throwing it out there. You could ask your doctor if you can do that. Again, help your body stay as safe as it can. Adhesions can also form within a year. So during that whole time, again, where who knew that radiation would last so long? It lasts at least for that 6 weeks. It's still, I guess, really strong, really still working, but it can also have side effects for up to a year afterwards. So again, something to know. And like I said, usually within a month or so of my finishing my radiation treatment, a lot of the side effects went away, except for like that neuropathy and all that. Although again, that was more due to the chemo pills, not the radiation. But otherwise, that's all what can go on. So that's my radiation journey, how it all worked for me, how it went. So again, if you have any questions, whether it be on radiation, whether it be on chemo, whether it be on cancer, on life, anything, leave it down below for me. And I hope this was helpful for you. If you know anybody that is going through this, if you're a caregiver, if you're just a friend, you kind of have an idea now too of what they may be going through, and a little understanding. So I hope you guys are all healthy, you are all well. Thanks again for joining me in this video, and you guys keep it positive. Go make it a great day. Bye-bye. Oh. Gotta love when I'm talking and the camera just shuts off on me. I finally had that intro down. All right, 5th time's the charm.